After the infection, it's really hard to talk about it. I don't really talk about this with anyone because it's painful. I only talk about it with my husband and my son a little. It's really traumatic to go through. Your teeth, your mouth, it's scary and there's like no going back.
So Marie is easily one of the most charming patients that we have in this practice, with one of the most complicated stories and paths to getting dental implants.
The real catalyst was about 2 years ago in October. I got an infection in my jaw and I was in the hospital for like 7 days and I lost this massive amount of bone. Little by little, I lost another tooth and another tooth. My bone just started disappearing.
So we talked about multiple options and multiple outcomes that made sense for her. And what she really felt like would be the best option for her is if we did a total replacement of her upper and lower teeth with dental implants, an all-on-X on top and bottom.
Courtney and Dr. Dodd really helped lift me out of my depression. They really love the group of people because it's a really tough thing to go through. I think that's why I chose to do the whole mouth. And Dr. Anver was, really, I trusted him so much when he advised me because it's really tough. I also was in danger of getting more infections. It wasn't just, he had to do a lot of work when he got in there. It wasn't just a little thing to start with. Dr. Anver's got a gift for just making you feel comfortable and you can trust him. You really feel it, from him. He gives you your personal cell phone number. And I've never had a doctor do that.